Well, good afternoon, everyone, and welcome to the first BPC virtual lightning round brainstorming session. I have no idea who's on the line, and so I will just say welcome. This is Jason Grumet. I'm going to be the master of ceremonies for the next 89 minutes. And just to kind of get us situated, I wanted to just share a little bit about the ambition a week ago that caused us to suggest this idea. I assume that everyone else on this line involved in the policy debate has also given the speech to staff and funders and themselves sometimes over the last couple of years that our moment would arrive, that while the policy environment was constrained and polarized, there would be a chance for public policy to, in meaningful ways, move forward, and we were going to be ready. So this is our moment we've all been preparing for. And I was struck last week that it is happening at a time of incredible anxiety and disruption, physical and personal estrangement. And I actually heard people saying the government was moving too fast, which is a sentence that had not been spoken for at least the last 5 or 6 years. And so while the motivation for this is authentically to try to advance public policy discussion, I have to admit that part of the motivation was to kind of be with my friends. We have organizations that compete for ideas and for talent and for funding, but at a very fundamental way, there is a community of people who dedicate their careers and lives and weekends to trying to think about how to make the country work better. And moments like this kind of cause you to recognize that. So this seems to be a compelling notion based on the 60 or 70 folks who are on the line, almost all of you in listen-only mode, which is none of our forte. And it pains me that Dr. Yellen and Susan Wartell and Maya McGinnis and others who I'd love to be hearing from are not able to be active in this discussion, though I hope we will have another. But so we have dual goals. The first is to basically be kind of a cheers bar for emergency economic intervention. And I think we will see as this goes whether there's an ongoing role for the discussion. We've also heard from Hill staff and some folks in the administration that they're frustrated by not having avenues to be engaging and explaining what they're thinking and asking questions. So again, if this were to move forwards, I could see us having opportunities to bring some of those folks forward. And then, of course, we want to advance some real ideas. Because while I don't expect that at any moment we are going to have a shared joint position about anything, I think it's really helpful to get a sense of who's thinking about what and at least enable in a more efficient way opportunities for follow-up going forward. So just a couple of logistics. As I said, we've invited a small number of people and there are a much larger number of people on the line. So understand that this is a public meeting. I think we should all assume that all comments are on the record. Secondly, all of our speakers have agreed that they are going to try to do something very unusual, which is to limit themselves to a single compelling idea among the dozens of compelling ideas that they all could share, and to try to do so in 5 to 7 minutes. We do have the Jaws music, so we will find some way to try to, like the Oscars, encourage people, if necessary, to wrap up their thinking. And then we'll have some chance for a little bit of a discussion going forward. We are trying to perfect the art of virtual engagement with written questions. We just are not there yet, but again, something we're thinking about for the future. So also note that the office is closed. There are less than 10 people here, and the couple in this room are 6 feet and 3 inches away from one another. And I know you're all grappling with the same challenges. So I really do appreciate everybody at this moment taking a little time to be part of the discussion. And now the technology will reveal itself. Our agenda, which we've shared with you, is loosely structured, and I emphasize loosely, around the notion that we will start out with just some macroeconomic insights from 4 speakers. We will then talk a little bit about the small business challenge, which we anticipate is going to be one of the next rounds of stimulus, and then a couple of folks want to talk about some specific ideas around family and household impacts. And so that is the general structure, though a couple of people have emailed me saying that they might want to change their best idea. So this is a dynamic process, and we will follow the discussion where it leads. So first, a dear friend of mine, the BPC's, Matt Chase, who's the executive director of the National Association of Counties, and very much on the front lines of people grappling with this challenge, was going to just share a little bit about what's happening at the county level and
Great.
Offer an idea or proposal. Matthew, the mic is yours.
Great. Can you all hear me, Jason?
Very well.
Great. Thank you to Jason and BPC. We really love BPC and the role that you play. I'm going to use my time wisely. We are focusing on a theme called Saving Lives and Restoring Lives. So right now, as Congress has already pivoted to the broader economy, at the front lines of public health, we are really struggling to contain this pandemic. Our daily numbers that are coming in are showing a doubling of positive cases pretty much every day. A lot of it is trying to balance what was already spread throughout the community versus what are new cases. But a key problem that we are facing is that since 2008, we've lost 60,000 public health professionals at the state and local level. So we are really stretched. The big idea that we have is really making sure we do not abandon the immediate surge capabilities that we need. So we are really way behind on testing, both access to equipment, kits, but also the data sharing. As private companies are coming in with their labs, the data is being put on Twitter or sent to the CDC before it's actually sent to local decision makers. So we are really struggling with real world immediate issues, let alone focusing on the broader economy. I will tell you, probably every industry trade group is reaching out to us, asking counties and cities to declare their industries as essential. Everyone from pallet manufacturers to pet stores to, of course, the railroads and the trucking industry. Just about every industry is knocking on our doors, asking to be exempt from city and county public health declarations. We have 260 counties that have declared public health emergencies under their statutory authorities. Obviously, much more states, but in many states, the county actually has to make the call at their level. So what we are focusing on for, I guess, today's call is our social safety net was already maxed out prior to this pandemic. Jason and I have actually talked about this over the last year. Our mental health, our behavioral health, our overall support for lower income, they were already maxed out. Our data kept showing, even with a strong national economy, with a howling out of the middle class, the demand for local safety net services was at an all-time high. Foster care, child protective services, elderly without access to regular nutrition. So this crisis obviously is only going to exacerbate it. In respecting the time, Jason, we also at the county level are really dealing outside of how we serve our citizens, have some interesting dilemmas financially. One, our tax revenues, particularly sales tax, will probably plummet. Our tourism taxes for hotels, rental cars, passenger facility charges at airports obviously will decline substantially. And a lot of these tax revenues are used to pay for multi-year bonds. So 30-year tax-exempt municipal bonds. We are losing our tax revenue to pay back those long-term bonds. So we're gonna have to work with the credit agencies to make sure that they're working with us. We have to figure out, we have to pay our bond obligations first. And of course, with Wall Street having its ups and downs, our pension fund liabilities have just gone through the roof. And under many state laws, we have to pay pension liabilities before we can pay for regular services. So our big idea, I guess, would be we have to figure out this balance between not taking our eye off the ball on immediate surge needs while we pivot to the broader economy. And that's going to be a real challenge. You're seeing it in these Hill packages. We agree with all the needs for airlines, hotels, and others, but we can't abandon funding local public health right now. The $950 million in the first package is literally a drop in the bucket. To give you some context, and I'll end with this, King County, Seattle alone, the county government has estimated it's going to cost them an extra $100 million in their immediate response. So I'll end with that.
Well, Matt, really appreciate, as we asked you just to kind of set the on-the-ground framework for us. And you also were exceptionally talented coming in under the 5-minute mark. It's always good to have someone set the pace, so thank you for that. As we imagined, we are having a little bit of technical difficulty getting a couple of our speakers to join, so we're going to shuffle the agenda a tiny bit. And if Jay Shemba with the Hamilton Project is online, I'd like to ask you to talk a little bit more about the idea you have suggested for a fiscal response to the crisis.
I am on the line. I think I've unmuted. Can you hear me? Very
well. Thank you, Jay.
Great. Thanks. So first, thanks very much for organizing this and for asking me to be here on this call. I think as people, are getting a growing awareness, this is going to be a severe economic shock, and I think we need to treat it as such. Even if there was literally no health problem in the United States, just what's going on in the rest of the world would have been a severe economic shock, and hitting pause on the economy for whether it's 2 weeks or 2 months is going to be a big drain on a lot of households and on the economy. And so I was thinking I was going to come after Jason Furman, because then I was just going to cheat and say I agree with Jason on everything he said about sending checks. So I'll just say that, and that way it doesn't count as my idea. But one of the things that I wanted to really emphasize is that, as much as I love the format of one idea, is that whatever approach we take here is going to have to be very broad, because anything we do is going to only touch certain people, and we're going to need a real package of support for the economy here. Beyond sending checks to people, I think one thing I would really like to emphasize is the ability to use the safety net. So the safety net's not going to catch everybody, and there are going to be millions of households who lose hours and tips and commissions, and that's why sending checks to everyone is a good idea. But the safety net is probably our most powerful way to get money into the most vulnerable people's hands quickly and effectively, and we know how to use it, and there are a lot of things we could do to use it better. So in phase 2, which still hasn't passed the Senate, they got rid of work requirements in SNAP, for example. Things like that need to go through. I'm a little worried the Senate's going to skip some of phase 2, sick leave and things like that, and work requirements, and jump to phase 3. We could make it a lot easier to get people onto unemployment insurance, whether it's waiving the 1-week waiting periods, whether it's getting rid of search rules for people in quarantine zones, things like that, getting people onto UI. When people ask me what can states do, getting everyone who is actually eligible for UI onto UI is going to be really important. If you look at recipiency rates, they're way down over time. And they're way down in part because states' trust funds are in trouble and they don't want people getting UI because they don't have the money. But this is a point in time where we need to use the safety net and need to use that UI. In fact, one of the most effective and quick ways to get money to the vulnerable households using the safety net is simply to increase the recipiency rates on the one hand, but also increase the payments. So under any kind of theory of unemployment insurance, you don't want to give too much because you don't want people to not search for a job because they're too comfortable. This is not the time where that's a problem. You should be giving people as much money as you think you should, and not worrying about the moral hazard. And so I think that means increasing the payments to households that are on unemployment insurance, extending the timeline for unemployment insurance. Some states, North Carolina, I believe, cut it back to 12 weeks. That's got to extend. And on top of that, though, you can do the same with SNAP, or what used to be called food stamps. So extending the maximum benefit, extending it a lot more for families with kids who no longer are getting their meals at school, trying to take care of these households that we know are vulnerable, and we can use the safety net to do it. A crucial part of that, though, is going to be federally funding all of this. And so anything you do to expand the use of unemployment insurance, you're going to need to fund federally, because the states literally don't have the money in the trust funds, and they certainly don't have spare cash lying around. And in particular, if we try to use a more expansive use of what's called job sharing, that I think about 25 states have rules under their unemployment insurance where you could reduce everybody's hours to 20 instead of 40, and that unemployment insurance would pick up that extra part, and that'd be a real important way to keep people from losing their jobs. So in addition to the safety net, the one thing I would just add, and this is part of it being both broad and sustained, is all of these things should have triggers that kick back in over and over if the economy doesn't recover. And so whether you're sending checks, doing unemployment insurance extensions, FMAP money going to states, all of these things should be on a rinse and repeat cycle where every 3 months, if the unemployment rate is still elevated, they keep coming back in. One of the real problems after the Great Recession was kind of a pivot to austerity too soon in the US and in Europe. And we can't just pass things that are going to happen once, because this has the potential to be sustained. And so I would just kind of close with that by saying that's really important. And then lastly, just to nod to our upcoming speakers, I won't try to go into these ideas, but there are ideas we could do to try to help out small businesses with their payroll costs, and that would be really important to keep them from laying off workers. So I'll turn it back over now.
Yeah, thanks, Jay. We are going to, I'm sure, have a little bit of a conversation about the interaction between the direct payments and the UI. So I really appreciate you putting that on the table. And your closing thought about small business is a wonderful segue to our next speaker. Adam Michel, who is a senior policy analyst at the Heritage Foundation, has been thinking and writing and talking about the next wave of this, since so many of our people who are out of work from small business. I think many of us running NGOs are all of a sudden aware of the fact that we too are small businesses. And I think that is something that we will be thinking about both selfishly and also on behalf of a national employment trajectory. So Adam, are you with us and able to jump in?
I believe I am. Can you hear me?
Very well.
Excellent. Well, thank you for inviting me. The one idea that I want to present is a fairly simple one, I think, and it's expanding access to net operating losses for businesses that need access to additional liquidity more quickly. The tax code generally allows businesses to credit their losses against their profits. And in normal times, this is helpful for, you can think of a startup business that may have several years of losses before realizing any profit. So the tax code essentially allows them to average their profits and losses over a period of time larger than the standard tax year by carrying their losses forward to periods in which they have profits. In the past, firms were also able to carry these losses back to previous returns, allowing them to receive refunds for taxes that they had paid previously. In economic downturns, this can function as an efficient way to get struggling businesses liquidity quickly. Unfortunately, the 2017 tax reform restricted the access and use of net operating losses in three important ways. It denied carryback, so businesses are no longer able to carry their losses back and credit it against previous taxes paid. Second, it limited carry forwards for larger corporations, limiting it by 80% of their net income. And for smaller, mid-sized pass-through businesses, it limited this loss carry forward to about $250,000 or $500,000 if you're a married couple. So my proposal is relatively simple. It's allow businesses to carry their losses back immediately for 2 or more years and remove any restrictions on these carry forwards. Congress could go even further in allowing these losses to be refundable so that businesses that don't have large taxable profits in the last several years can still benefit from the change. And if they wanted to, they could go one step further and allow businesses to estimate the coming 2020 years worth of losses, assuming several consecutive months of disruptions, and make these projected losses also eligible for immediate refunds. There's precedent for doing this. We expanded access to NOLs in past economic crises, most recently in 2009, expanding the carryback from 2 years to 5. And so expanding these net operating losses, I think, would be a good reform in normal times, but it's a critical reform today in the face of an economic downturn, giving businesses an ability to access the tax benefits that they would get in the future right now, so that they can make ends meet. So, thank you.
Thank you, Adam. Really good to get the tax code into this discussion. I think we're going to have a little bit of a conversation about when we imagine the larger complex tax issues coming forward to the Congress. We are, as you would expect, somewhat nimble and opportunistic as our speakers join, plugging them into the agenda. I am told that we've had Jason Furman join, and as he kind of limbers up and gets a sense of this, I'm going to ask BPC's very own Linda Smith to continue the focus on small business, one of the most critical and vulnerable small businesses in our society are childcare. And as we all recognize, as we spend hours on video calls with our pets and children, it is a challenge to both provide childcare and work at the same time. And so I think Linda, who's now being dialed into the lens here, is going to offer some thoughts about the childcare challenge and a couple of specific ideas about what we might be able to do.
Okay.
It's all yours.
Well, thanks, Jason. And I really want to thank you for including childcare in this conversation, because it usually is forgotten until it's reached a critical point. So what I wanted to do before I get to my one idea, which I should say has two parts to it. Okay, of course, I just had to do that. But I want to talk a little bit about childcare in America and what it looks like so that our audience can understand sort of what we're dealing with here. Childcare in America is a market-based system and mostly comprised of small mom and pops around the neighborhoods, family childcare providers, and then some of them pour in the bigger chains like Childcare and Bright Horizons. All of that said, we've known for quite some time that the childcare market, the business model, just doesn't work. And as I say frequently, we have a broken business model in childcare. And to prove that point, one of our sister organizations here in Washington, the National Association for the Education of Young Children, went out and surveyed members, and the response was that about 2/3 of the current childcare market is in danger of closing within a month of being shut down. So we have a pretty serious situation on our hands out there. That said, this is only exposing what many of us knew about childcare for a long time. And that is that we have a model where it simply costs more to produce quality childcare than most of our customers, the parents, can afford to pay. We've all heard horror stories about childcare around the country, and costing as much as $20,000 for an infant in childcare in some of our big cities, including here in DC. That said, our workforce is pretty much living on poverty level wages. The average wage for a childcare worker in this country is below $12 an hour. So with that said, what we have, I think, in this country right now in childcare is a disaster within a disaster. And so what are we going to do about that becomes the real question in order for our families to go back to work when we get through this current situation. We really do have to focus on childcare and get something done about it. So my big idea is pretty simple. It's, as I said, a two-parter focused on Congress. And as Congress moves forward in the next days and weeks to look at the childcare issue, the first thing we need to do is take a look at the disaster relief funds that are available through Congress already and the small business loan process, because both of those are not widely available to childcare businesses. On one hand, the Stafford Act makes funds only available for nonprofits, and then the small business loans are only available to for-profits. So our community is caught in the crossfire on that. And we would like to see Congress make modifications to make these funds available to all childcare programs, no matter what their status is along those lines. The second piece, which is a focus on the demand side of the equation, is to get more money out there to help, especially when it comes to people needing to work on the front lines for childcare workers, healthcare workers, et cetera, and would do that through increasing funds into the CCDBG, the Child Care Development Block Grant, and allowing through changes to eligibility requirements for more people to qualify for these funds to keep our healthcare and our frontline workers going. And the second piece of that would be through the Child Care Development Block Grant to include some funding through the quality set aside to allow states to basically preserve and protect childcare programs through those quality funds and shore them up in the short term to get us through this piece and make sure that when we get on the other end of all of this, that we have childcare available so parents can go back to work. And it's pretty simple. If we don't have childcare, we don't do much work in this country. So that's my idea. Thank you, Jason, for including childcare.
The notion that I could survive here at BPC, Linda, having not included childcare is a great fiction, but appreciate the enthusiasm as always. Jason Furman, have you found your way through the thicket and joined the call? Is your mic muted? All right, well, while we're figuring that out, I'm wondering if our dynamic duo from Niskanen, Samuel Howard and Jeff Cabaservice, have made it on.
Hi, this is Jeff Cabaservice from Niskanen. I'm on the phone. Can you hear me?
Very well, Jeff.
This is Sam. Am I coming through?
Terrific. You were both loud and clear, and you were going to share some, I think, broad thoughts about fiscal response. So I don't know how you plan to tag team, but the mic is yours.
I guess I'll lead us in. So first off, with the House paid leave proposal, there seems to have been some near-term unintended consequences. There's already early reports that some businesses are shedding employees in the belief that the mandate, which is only partially funded, that they need to basically shed these employees before the mandate comes into effect. And this is partly just a gross miscommunication about how the paid leave portion of the House bill actually works. But it brings up an important issue, which is conventional fiscal stimulus aims to boost demand and therefore boost employment. But right now, the issue is frankly that we don't want people heading to work, and so we in that case need to have some form of incentive for labor hoarding, some kind of credit for companies that retain their workers and do not shed employees, particularly in the false belief that they're going to be suddenly liable for sick pay. The second point I'd like to just raise is that there's just been an astounding level of consensus, particularly in the Senate, and the need for direct fiscal relief. And I just want to caution, someone else said earlier that phase 3 stimulus risks sort of overshadowing the importance of getting the House bill passed. But going forward, I think there's also a risk that debate over minor differences, distinctions in how fiscal response is implemented, who benefits and by how much, will get in the way of it will obscure the huge extent, the unprecedented extent of at least directional agreement. So that's why Niskanen, and you can find it on our website, just released a new commentary, essentially calling for a synthesis between proposals put out by, on the right, Mitt Romney, Tom Cotton, Josh Hawley, and on the left, the Booker Bennett Brown proposal, and really trying to unite these and find the common ground between all the proposals, rather than trying to make perfect the enemy of the good. And then lastly, on the business side, there's a lot of open questions about how best to support businesses quickly. There have been discussions about using development block grants, which have precedent in disaster relief, like in Hurricane Sandy, and in the post 9/11 context. But SBA loans shouldn't be discounted in this case. One of the bigger critiques of SBA, especially 7A loans, is that they can take months and months to actually process. However, the SBA has an express loan product which doesn't require review by the SBA, and traditionally banks can turn those loans around within 36 hours. So I think much needs to be done on that front in essentially shifting the review process towards something more like the express loan process, waiving interest payments, at least for the first 6 months, and making sure banks are able to get loans, short-term liquidity lending out the door to small businesses, and with a much higher federal guarantee than is typical. And if Jeff, do you have anything to add to that?
Let me just extend one point that Sam made, which is the idea of labor hoarding. The idea here is that businesses would retain workers on the payroll even when there isn't sufficient demand to justify their employment. And this obviously is good for the workers themselves in the sense that they keep income coming in and they don't lose health and other fringe benefits. But it's also good for the businesses in the sense that they don't incur the considerable costs that come from losing workers and then being forced to retrain new workers as well. So labor hoarding is something that we want to encourage, and it can be encouraged at the federal level through some kind of tax credit for employers who maintain their payrolls at some stipulated percentage of the previous averages. Someone like Tim Bartik, I believe, has called for a 90% retention of the employment level at the last quarter of 2019. But the again here is basically keep the money coming into this picture, and you avoid all of the considerable problems that come from workers losing their jobs in such times. I'm actually happen to be reading a number of accounts of this, and self-reported happiness drops 10 times as much from a loss of a job as from a major loss of income. And then long-term jobless men are 3 times as likely to be treated for depression as other men. So this is the sort of thing that we would really want to avoid if possible in this recession, which maybe even be moving toward depression levels.
Right, and just to put a final point on this, this is really unlike any other crisis. It's not a normal recession, and therefore, while I strongly support cutting checks to people to hold them over, there's also a need to have fiscal stimulus that's triggered not just if economic conditions deteriorate, but with a level of discretion at the level from the Treasury to try to time stimulus for when we return to normal business conditions. Because right now, there's counterintuitively, a big fiscal stimulus won't really do much if we're enforcing mandatory business closures and quarantine measures. So we need triggers connected to to economic conditions, but also to a broader judgment that it is now time to begin ramping up for a recovery, rather than just linking it to, say, the unemployment rate.
Hearing some themes around triggers and sequencing, which I think we will come back to. I believe Jason Furman has now joined the line.
I think I'm here. Can you hear me?
You are here. And as I introduce Jason, who I think is known to you all, Jason sent me what I found to be the most delightful email in the last several days, which was late one night when I was in the grocery line, indicating that while he had intended to talk about direct cash payments, he was growing more excited about the German direct lending programs. And I thought the words excited about German direct lending was something that just suggested that there will be normalcy again in the think tank industrial complex. And so I was delighted by the note, and of course indicated that, Jason, this is a game day decision. So your best idea is whatever's on your mind at this very moment, and welcome you to share it.
Great, Jason, thanks for organizing this, and sorry for my difficulties. And I will surprise you once again. I'm in favor of any argument for any idea that anyone's made. I am skeptical about any argument against any idea that anyone has made. I think at a time like this, none of us have any idea as to what the timing of any impact of most anything is. So we're taking wild guesses. So I'm all for the union of ideas, not the intersection of them. I, do think that, and then I'll get to the idea that, it is exceedingly difficult to design programs and implement them in the best of times. It is so slow. It is so cumbersome. I refer all of you to the Affordable Care Act website. It wasn't just that it mislaunched. It was after it mislaunched, some of the best people in government and the country came in and spent them 4 months to fix that website. Right now, people couldn't even be face-to-face with each other as they designed and implemented these proposals. So I just am erring towards as simple as possible. I think everyone is familiar with the cash idea. I'm one of many people that has talked about it. I think that is sufficiently appreciated. I continue to think it is a good idea, but I will reserve my time on that now. I think the highest value ideas are in the space of preventing people from losing jobs, as we were just hearing. I just am still not sure what it is I like in that space. 2 days ago, I liked German lending, where the government guaranteed 80%. My thinking had trended up to 95% guarantee needed. Now it's 100%. I think a loan has an advantage also, that if we need to forgive it, we can. But if it isn't as bad as you think it's going to be, we can get the money back. So it has, in effect, a form of contingency built into it. What I am instead going to use, whatever 2 minutes I have left, is to just advocate something incredibly simple, incredibly needed, and the thing I think that is most underappreciated in the debate right now, which is fiscal relief to states and localities. Each percentage point of the unemployment rate goes up, costs $40 billion in reduced revenue. The FMAP in the House-passed bill is well designed for a recession, and not a recession, a slowdown, in which the unemployment rate goes up by 0.9 of a percentage point. The unemployment rate could easily go up by 6 percentage points. That would be $240 billion of foregone revenue. The foregone revenue by states and localities is likely to dwarf the emergency costs, addition to costs that they're going to have as a result of this, but that is certainly going to be a large number as well. I've spoken to many state authorities and some local in the last week who have great things they can do and ideas on the health side, on the getting ventilators side, on expanding hospital capacity, on treating people, on helping small businesses weather the storm, on expanding unemployment insurance, on setting up meals, go through the list. And there's terror about the fiscal constraints around that full set of activities. I think it's likely that states will need about $250 billion over the next year, and absent that magnitude of money, we'll have to curtail either emergency actions, education, police, or the like. My specific proposal would be a large increase in Medicaid matching. Start with 15 percentage points and adjust up as economic conditions warrant on a state-by-state level. But that would not by itself be enough. In fact, temporarily federalizing Medicaid would likely not be enough. So in addition, I would potentially tied to the unemployment rate, do additional unconditional federal funding for states that would be designed that if the unemployment rate went up by 1 percentage point, you got an additional $40 billion of relief, some of that from FMAP, most of that unconditional aid. And this idea is not going to solve the problem. I think the solving the problem is in the preventing businesses from laying people off. This is something that could be legislated incredibly simply. I'm sure it would make a big difference, and it would actually help fund every other idea anyone's talked about, just implemented at the state or local level.
Thank you, and I really appreciate not just the idea, but also the focus on mechanism. I think one of the things that I know we're all focused on is this question of once we get our aspirations together, once we get legislation together, once we get actual public policy, how do we actually flow trillions of dollars to hundreds of millions of people in ways that actually solve the challenge? So I think we will hopefully come back to that. We have, yes.
Can Jason Furman, can you repeat where you got the $240 billion in the foregone state and local revenue?
Well, I can't imagine everyone can see the speaker. I'm quite certain that's Matt Chase.
Yes.
Oh, can you hear me?
Yeah.
Yes.
Oh, I've just done analysis in the past that shows each percentage point in the unemployment rate is associated with a $40 billion shortfall. That's just at the state level. And so then I just said, if the unemployment rate goes up by 6 percentage points, which might be a good case, then 6 times 40 is 240. Could the situation now be different because you're losing all sorts of revenue on sales and the like, so incomes actually are exceeding spending, and so it's worse than that traditional rule of thumb? I think that's very plausible. So I think it is, so 240 is not even a best guess. That's just a perfectly plausible, maybe very conservative scenario.
We're all doing a lot of napkin math.
That's all right.
So
Thank you.
We have between 1 and 3 more presenters, depending on who is able to join, and then we will have a little time for the panelists to interact, and a couple of my colleagues may join me in asking a couple of questions. So I believe that next in the queue is Nicole Kading with the National Taxpayers Union. Nicole's suggestion was to delay filing, so the delay issue here may just be part of her dramatic entry. Has Elaine joined us yet? Aparna.
Hi, this is Aparna.
Hi, Aparna. Thank you for saving our flow. I think most of you know Aparna is a scholar with the American Enterprise Institute, and was going to share some thoughts about some sick and medical leave issues that should include hourly and part-time workers. Please.
Yeah, great. Thank you, Jason.
Speak up.
Yeah, thank you. And it's been great listening to all the discussion before this, which I agree with wholeheartedly. I think this is not going to be a one-off plan that has one big idea in it, but really has to be a multi-pronged approach. When I even before the crisis struck, one of the areas that I was working on was looking at paid family and medical leave, and also sort of the conjunction of that with sick days. And what's become increasingly clear over the course of the crisis is that the first initial impact was on workers who were unable to take that time off from work in order to either get treated or tested or quarantine themselves. And so when you look at these sort of the statistics on who has access to paid sick days, who has access to paid medical leave, It's typically the most vulnerable low-wage workers who don't have access. About 30% of workers in the bottom 10% of the income distribution don't have any paid sick days. And that has, of course, become very clear. We are hearing stories every day about how companies are either letting workers take unpaid leave, which means that they are economically insecure because they don't have any paycheck coming in, or they just don't have access to any paid time off, and so they're showing up for work, and that at a time when we're encouraging people to stay home from work as much as possible, to work remotely, or quarantine themselves is just not acceptable. What we're seeing in terms of the proposal on the Hill that's doing the rounds, it talks about giving workers about 14 days of paid sick days. So that's about 2 weeks of paid sick days and about 10 weeks of medical leave. And there have been various versions of that. Some of that is initially it was paid sick days and medical leave that would apply to workers broadly, even if they were providing care. I think the latest version I'm seeing, or at least that's under debate, says that the sick days would apply to workers who need the leave, but the medical leave would only apply to people who were actually providing care either to their children or someone else who needed it, and wouldn't really be available to people who need leave themselves. And I think that just makes no sense. I think we need to allow workers who need to quarantine themselves, who need to go and get treated, that medical leave and that medical paid time off. And so that would be sort of the basic first suggestion, that just having paid sick days in there is not going to be enough. We probably need longer leaves that could be done through an additional paid family and medical leave package. The ideal way to fund it, so what's being discussed right now is employer tax credits. And again, while that's well and good, because as all of us realize, businesses are not going to be in a position to pay for this, for this additional cost, especially with the recession looming on the horizon. But I still feel like, employers, even if we do it through tax credits, that's only something that's going to come in much later in the cycle. That's, payments that are going to come to them much later. And if there's a way that we can finance companies right away, not just for unemployment, like we talked about and like Jay talked about earlier, but even for the sick days and the medical leave component, if there are either loans or some funding mechanism that can immediately provide that funding to companies that are allowing workers to take that leave, allowing workers to take medical, paid time off, I think that would be a better idea than doing 100% refundable employer tax credits. The other provision in the bill is that this would only apply, these mandates would only apply to companies with fewer than 500 employees. And again, we are realizing that this is not just a crisis that's going to hit small or relatively small businesses, but really will affect companies as a whole. And so I see no harm in, on an emergency basis, extending these provisions well up the ladder to larger size businesses as well. And I think in the slightly longer run, sort of figuring out, if, even for employees who take that leave but then have to be laid off, how can we use the existing unemployment insurance system to make sure that workers whose hours are reduced, not just workers who face job losses, but who face significant cuts in hours, which applies to gig workers and temporary or part-time workers. How can we make them whole? How do we hold their wages stable through the crisis, which could be not just 1 month or 6 weeks, but really 2 to 3 months or longer? How do we make sure that our UI system is functioning and working to meet that need? I think would be really critical. And here again, the work sharing idea that is being discussed a lot, I think makes a ton of sense. So I think workers are hit more when they feel like they're laid off. But if the hours are reduced, at least there's the, at least mentally, a lot of them might feel, well, there's the option to at least go into work and get some paycheck coming in. Whether it's reduced, it is a lot better than having nothing come in. So I think figuring out ways that we can keep employees on the payroll by federally funded, payments or, paychecks or UI, shoring up its systems. I think all of those ideas make a ton of sense. I think a cash stimulus or cash transfer can work as well in helping workers feel whole. But I think the biggest issue right now is feeling that attachment to your job. And we need to figure out, just as many ways as we can use the existing safety net to allow that to happen. So, I would really like a lot of our resources to be focused on that. Thanks.
Hey, Jason, can we ask a quick question or make a comment?
So you can do a quick comment. We have two more speakers. I want to get through them, and then we're going to have a little bit of a collective discussion. But if it's a real specific question, Matt, ask away.
Very specific on the paid family medical leave. It also exempts state and local governments and any political subdivisions. We're trying to get a handle on that. Two, if the think tanks could help us from a state and local government perspective, we're struggling with the uninsured. We actually also, we employ 1% of all Americans at the county level. What we are also concerned about is thinking through COBRA for those that are let go of the ACA and understanding the ACA employer mandates for healthcare. So if there are any think tanks that have expertise in that, we would appreciate it.
All right, Matt, you are warming us up for the conversation that will begin in about 10 minutes. I think our last two speakers are both with us. Nicole, do we have you on and mic'd up?
Can you hear me now?
We can hear you now. Thank you.
Great.
So I think most of you know Nicole.
So I'm glad we figured it out now. So first of all, thank you for having me. It's a great honor to be here with a number of folks whose work I've admired for many years. What I'm going to be talking about is delaying tax payments. Now, things are moving very quickly in this space. And in fact, while the time we've been on this call, Treasury has actually issued some additional guidance in this area. But I first want to walk through why I think this is important, and then I'll quickly tell you why I think that Treasury guidance is actually falling short of where it needs to be. Traditionally, I will admit that I have not been as receptive to stimulus as perhaps other folks on this call have been. But I do think this is a time in which it is imperative that we provide assistance to affected individuals and businesses. I think, of course, this recession that we are beginning to be in is very different than those historically, and in part way, I'm motivated actually with more of a moral obligation. We are asking individuals and businesses to shoulder an immense economic burden, and that is to close their businesses, to go home, and to leave their jobs. And I think that we have a responsibility to them to help them go through that. And as I think about the various ways that we can do that, obviously cash is one of the most important things that we can do at this moment to ensure that individuals can meet their obligations that they still have while working fewer hours or perhaps being laid off. And also businesses, that those that have shut their doors and have lost a large source of their revenue, how can we help them? And one of the ideas that came to me immediately was the federal government's ability to, in essence, pause or turn off tax payments. April is an important month to the federal treasury. The last several years, in March, the federal government has collected about $250 billion in revenue. In April, it has collected almost $600 billion in revenue. So it's an important month for federal revenues. For the individuals, it's of course the tax filing deadline of April 15th. But April 15th is also the quarter one estimated tax payment deadline for businesses. So not only do we have individuals paying their 2019 tax obligations, we have businesses paying their first tax obligation of 2020. And so I have called on Treasury to delay quarter one estimated tax payments. And then due to peculiarities in the way that we handle taxation, quarter two estimated payments are actually due in June, on June 15th. And so I think the administration should delay those payments. I think that has a lot of economic benefit, keeping cash in with individuals and affected businesses, I also think it has logistical benefits too. Obviously, many VITA clinics, for instance, have had to close or scale down their operations. Many CPA firms and tax prep offices have had to scale down their operations. A number of federal employees are now teleworking, and the IRS is seeing a bit of its workforce stretched on this. So there's a bit of benefit both economically and keeping that cash in individuals and businesses' pockets when they need it at this moment, and also logistical, allowing more individuals to shelter at home and help limit the spread of the disease. On Friday, the president announced his declaration that this would be a federal disaster, empowering various provisions under the Stafford Act. One of those gives the Secretary of the Treasury the ability to delay tax and filing and payment deadlines for up to 12 months. The Secretary has exercised part of his authority here and has announced that individuals can delay up to $1 million in tax payment. Partly that's to ensure that many pass-through businesses can delay their tax authority, and then businesses can delay up to $10 million in authority. However, I do think that the Secretary's guidance is a bit lacking. One, it only applies to quarter one payments. It does not apply to quarter two. So while we're going to delay the quarter one payments to July 15th, on June 15th, the quarter two payments would still be due as of this moment. It also, they have not waived the filing requirement. So individuals will still need to file their taxes. They just don't need to pay any remaining liability. That puts immense burden on low-income individuals that frequent those VITA clinics that have closed. I would like to see Congress now go in and clean a bit of this up. Provide an automatic delay. Allow this delay of payments and penalties and interest to be automatic. Individuals don't need to file for it. We can also just provide automatic extensions for individuals that have not filed their tax liability by April 15th. And related, I'd like to also see additional consideration given to the electronic signature of tax forms. Currently, businesses are unable to use e-signatures when filing their tax forms, and that's presenting a large challenge to many in this space who are having to overnight documents to each other's houses because they can't just walk down the hall as simply as before. So I'm glad to see Treasury's making a step here, but I'd like to see at this point now Congress go and expand that because I think it's essential that we delay these obligations at least for a few months to keep individuals and businesses with a little more cash than they have before.
Thank you, Nicole. That was exceptionally insightful and specific. And I have to think that if we do wind up both managing to get direct cash to people and delay tax filing, Congress's approval rating could go from 9 to 16, which would be a huge experience for American democracy. Last but not least, following up on the tax theme, but in a more kind of tax credit focus forward approach, we have Elaine Mag with Urban Institute and Tax Policy Center. And nice to see you. Please wrap up the presentations.
All right, first of all, thank you so much for allowing me to be here. I'm sorry I was late to join. I had another meeting. But my proposal, I think, is relatively simple and it shouldn't take too long. So I have first two order concerns. I have two sort of first order concerns, and these are, I want to get money to people who we know are vulnerable, and I'm trying to target sort of an early payment that in the end might end up just being a boost. It's not mutually exclusive to any of these really broad plans, but what I worry about is sort of, you know, Senator Rubio saying we're not going to be able to come back a million times, and so I sort of want to get extra assistance out to this vulnerable group before we run out of appetite. So the two big issues are people are losing their jobs, of course, and already vulnerable people aren't being able to keep up with their recurring bills. So I want a plan that's simple, and I'm looking for something that can be done without getting tied up in sort of a larger debate. So my proposal is to extend a second EITC payment to people who claimed the EITC in 2019. So they're filing their taxes right now. Now, admittedly, I thought I could count on returns being filed by sort of the middle of April, and most low income returns already being submitted by now. So my idea was we'd already have the data. It would be pretty fresh. We know their bank accounts. If they're on direct deposit, we know where they live. So let's, send out a payment, just a second payment right now. This would provide about $70 billion in assistance. So it's sort of small potatoes compared to some other things out there. And it's very targeted. So it's these folks who are in the bottom 40% of the income distribution. I would absolutely support eliminating the phase-in of the EITC and providing just a maximum credit to those folks. And I would also support providing a substantial benefit to childless people and sort of pretending that a childless EITC existed that looked very similar to the one-child EITC, and that raises the price tag by about $45 billion. But it's all information that's on the tax return already, so the IRS presumably could just calculate that piece automatically. So the second payment that I'm advocating sending it out, it delivers key benefits. It delivers benefits to this key group of people, many of whom we already know spent last year sort of hurting in some way. So why focus on them? It's because, in my view, our normal safety net programs are already set up to automatically respond to increasing needs. So if you're a SNAP beneficiary and your income drops, you get a bigger SNAP payment. You become eligible for Medicaid. Unemployment benefits kick in if you've lost your job. But the EITC, which is a key pillar of support for many families, it doesn't automatically respond to changes in earnings. In fact, the very nature of the program slows the response since we wait several months to deliver the benefit. So if we instead extended just a second payment, it would mean that people who have recently relied on this EITC will see an immediate increase in their benefits, sort of responding to this crisis right now. So while people who were on the EITC in 2019 might become newly eligible for some of these transfer programs, they most certainly will have a delay in accessing them. So this quick cash payment could fill the hole as a transition to more traditional transfer benefits. And just like the EITC often serves to pay off credit card bills or people who have gotten behind on different things, this second payment could help shore up finances for people. It's a mechanism they're used to seeing, and it's a mechanism that we already know how to deliver the payments. So that's the idea, and I look forward to the discussion.
Everyone who has participated, and I am able to share with you the encouraging news that just about everybody who's joined the call is still on the call. So as a matter of people voting with their feet, you've all done wonderfully. We're now going to try to have a little bit of interaction. I have some questions, some of my colleagues do as well. But just to get things started, I wonder if any of our panelists have ideas to add or thoughts or questions to pose to one another. And just speak your name as you ask your question, since not everybody is visible on every screen. All right, so recognizing that technology can be a little bit intimidating, I guess I would try to start out with a couple of questions around this idea of direct cash payments, which I think we probably all know is happening. And I look to Bill Hoagland, who has come to terms with the fact that the deficit is not going to be high on anybody's mind for the next 72 hours. I wonder if anyone can elaborate a little bit, though, on the mechanisms of the idea, right? The premise of $1,000 checks to every single person in the country has a certain simplicity and heroic inefficiency. There are discussions about means testing. There are discussions that people have mentioned about triggers, so this becomes sustainable. Jay, Jason, others have made this part of their remarks. I wonder if anyone would like to kind of add a little more detail to what they think is the best approach.
This is Jay. I'm happy to speak, and happy to defer to Jason if he wants to hop in. But if anyone's interested in the long form of this, in a book we put out last June called Recession Ready, there was a chapter from Claudia Sahm on basically this idea, wishing we had set it up previously with automatic triggers. But the logic behind it is this, especially in this instance, is there are millions of households who quite simply aren't going to be all the way into the safety net, who could use a lot of help right now. That they're losing hours, they're losing shifts, they're losing gig income, they're losing second job income. And all of these people are going to be struggling. And, if one way to help them is to send out money more broadly. There's a logic that in the research that people have done, that this seems to be more helpful to people. People recognize it more, are more willing to spend it and change behavior if they get it lump sum than if they get it kind of in dribs and drabs through a payroll tax. I think the other reason kind of the policy wonk community was more in favor of direct checks as opposed to a payroll tax cut is that the payroll tax cut is going to be tilted towards higher income people just because it's helping the people who have a higher payroll. So I think that was the other real rationale behind it. I think in terms of mechanisms, it is tricky. I've heard claims from Treasury that they can get this out or from the Treasury Secretary that they can get this out very quickly. I think previous experience has suggested it may take a little longer. And so I think that's one thing people are a little worried about. And maybe some of the urgency behind it is just, it's not like once we say yes, the money is out the door. It can take a little bit of time. But I think really the logic is there are a lot of people who are going to be hurting. We should do absolutely everything we can with the safety net, but that's not going to help everybody. And on the means testing piece, I think many people, at least certainly I would say, I think you can means test on the back end. Anything you do to means test on the front end potentially slows it down. Whereas you can literally just, have your 2020 taxes be slightly higher for people over whatever income cap you've got that you wanted them not to get the $1,000 check. You basically take it back a year from now rather than worry about who's getting it immediately. But I will just add, as simple as it sounds, the administration of this is not trivial. If you want it to go to everybody, not everybody paid the IRS money last year. Not everybody had to file taxes. You need to try to bring in information from Social Security and from Veterans Affairs and potentially from SNAP to try to find households who aren't getting the money just because they had a filing last year.
And not heard the idea about the next year clawback, which I think is really fascinating. Jason Furman, anyone else want to join the direct payment conversation or pose a question? I also remind a lot of folks that your mics go to mute if you do not actively seek to speak. I want to then move to another theme that we've talked about a bunch, and this is this notion, or talked about a bunch is probably an exaggeration, but the idea that these policies could be self-actualizing, that they could correct for the uncertainty that I think we all know is roughly 100%, with either triggers or automatic payments. Congress has had a hard time with those ideas in the past, much as they've recognized they're not going to be around. The idea of putting something in motion that they don't have control over, I think, has been not an active part of most policy regimes that I'm aware of. Are there any examples out there that anyone could point to that demonstrate the success of this possible idea?
This is Sam Hammond. Just to point out that under the Bush administration, advanced stimulus checks were sent out twice, without anything on this magnitude of a crisis. And I acknowledge the logistical details and difficulties, but there is precedent, and with the right emphasis and will, and trying to connect identifiers across different agencies, this should be possible.
Any other insights on this idea? I'm trying to figure out what's the right amount of awkward silence in a video experience. In an actual experience, I only count to 4, but I feel like this is magnified. Bill.
Jason, can I fill your void here for just a second and go back to Jason Furman's discussion? Okay, I'm an okay boomer, so I was around when I remember the 1972 General Revenue Sharing Act, State and Local Fiscal Assistance Act, where we had called revenue sharing. I guess, Jason, you're talking about providing $240 billion. Wouldn't it be easier for Matt's counties and states and just to simply have a simple, straightforward, go back to general revenue sharing and cut a check for each state to allocate to take care of some of those issues that you mentioned that the states are dealing with? No takers.
We will come back, I think, in follow-up to a lot of these questions about mechanism. I will note on behalf of Michelle Stockwell, who I think is on the line and leads our congressional work, the questions we are getting are not about intent. I think very much like this conversation, we are finding greater alignment about the goals and I think the appreciation that we are going to have to do things that are both forceful and messy. The questions are coming back now as how. The difference between the imperative and legislative language, I think, is going to start to slow this process down. And so I think one of the hopes that I have for this conversation is that not that we are going to be able to coordinate any kind of action, but that people will begin to really try to drive those specific ideas into those debates. And if anyone has questions about who's asking those questions, we'd obviously be delighted to try to help connect some of those dots.
Jason, just real quick, Matt Chase from NACO. I can't answer Bill's question exactly, but one thing I would ask help as you think about these mechanisms, what our public health folks are telling us is we don't have to just worry about dying from these viruses. We have to think about how we live with them. And what they mean by that is we expect this virus to taper off in the summer. But like our counties in California, for example, some of the bigger ones are already having teams think about when it comes back in the fall and next winter, that these viruses tend to ebb and flow. And so we have to think about right now and helping the economy today and in the next couple of weeks. We think we'll have maybe 2 or 3 months in the summer to regroup a little bit and get the economy going. But we shouldn't think that it won't come back next fall like the flu and other viruses of these families. So as you think about the mechanisms, help us think about reoccurring and things that will need to be repeated potentially over time.
Excellent and frightening point that I think we are all attentive to. Well, so I want to just maybe suggest a couple of themes and open up a couple questions that we can use following the call. And again, I really appreciate everybody testing this out with us. This is an experiment in technology as much as anything else. So just let me note a couple of closing thoughts. The first is that we have demonstrated the vastness of the challenge and its intricacies to each other. We did not have the intention or capacity to try to kind of curate an agenda, but clearly there are a number of just absolute emergency interventions that people are interested in talking about. We've heard a number of ideas about kind of interim, I think of EITC, tax delay as proposals that will provide potentially tremendous relief over the next 18 to 24 months. And then there is this kind of idea of recovery and a series of issues that, as many of you have pointed out, have been very much aspects of the frailty of our economy over the last several years, but that have now been highlighted. And how do we deploy resources in ways that will have lasting benefits? I think many of you went through in real time the stimulus in 2009. And I think there were a lot of lessons learned from that, a lot of success and a lot of cautionary insights that I'm hoping this community can also try to bring to bear. As I said in one of the original notes, in terms of next steps, we don't know, right? We did not have the hubris to pretend that we had a plan, a trajectory here. We wanted to see if anybody was going to come to the party. It would really be helpful if, following the call, any of you who have thoughts, candid thoughts about was this useful, how could it be more useful, please send over a note. There are a number of exceptionally talented people on this call who were not able to be included in the agenda who have indicated a desire. And so I think once we get a little bit of crowdsourced feedback, we will decide whether it makes sense to try to do something like this again in a week or so, and whether this format makes some sense. The other thing is that BPC is delighted to be able to be part of this process. We have no anticipation that we are the only organization capable of convening large discussions. And so if other organizations want to talk about how we do something collaboratively or possibly trade back and forth, I think this is important to me that we can play a role in having this discussion, both because I really do believe it advances our thinking, but I also think just sustaining this kind of camaraderie at this moment of anxiety is important. And so with that, I will thank everyone who joined, and please encourage you to send us some thoughts really candidly about whether this was useful and whether there are ways that we might take good use of each other's limited time going forward. So thanks, everybody. Have a good afternoon.